This video is to demonstrate your daily routine in 3 minutes or less. The first exercise is we're going to feel our pulse points. They're above the eyebrow. You feel lightly with your fingers till you feel a pulse. It may take 20 to 30 seconds. Once you feel the pulse, you know that you've got blood supply going through in a very nice even way and your tissues are relaxed. And then you take your fingers and you go down to your jaw and you hold it there for 20 to 30 seconds until you feel the pulse. And once you feel the pulse, then you know that you've created a facial release. The next exercise we're going to do is you take your fingers and you find the belly of your masseter muscle. It's a muscle that helps you when you close your teeth, the muscle pops out, and when you have then you have a top muscle called your temporalis, and you tap, that muscle pops out. So those are your two closing muscles we're going to focus on. The masseter muscle, you find the belly of the muscle. It's a muscle of anger, where we store a lot of emotions. We let go of our teeth are apart, and we get in and we massage the belly of the muscle. Once we feel that muscles are relaxed and there is no more tension held, then we can now go to what we call the downward jaw. The downward jaw is where you grab the corners of the muscles, corners of the angles of the jaw, and you pull down and forward in a very gentle stretch. Down and forward, down and forward. This relieves tension from your jaw joint and creates space there, and it's just a beautiful stretch that just feels so good. Once we've completed that, then we would like to do our masseter exercises. Our isometric exercises. Those exercises are where if we have hypermobility of our jaw joint or we need to tighten up our muscles, we open our mouth, and we create a fist, we put it under our jaw, and we press against. 1001, 1002, 1003, up to 10, and then one side, 1001, 1002, 1003, up to 10, and the other side, 1001, 1002, 1003, up to 10. 10, 10, 10 is 30 seconds, 4 times a day, which means 2 minutes that you'll be able to do the isometric exercises if necessary. And then the other exercise that we like to do on the face is called up, out, down, and back. It's a very important exercise. It looks after the temporalis muscle that we talked about and the masseter. So we go up, out, down, and back. Up, out, down, and back. You go back, not forward. And what that does is it takes out all the nubbles within the tissue. It creates a nice smooth muscle, so there aren't any little trigger points or little bubbles in there or little P's, and that way the muscle can realign its fibers to be nice and smooth, so there's less tendency to want to grind or clench. And then if by chance you happen to have headaches, neck tension, or you still have some jaw discomfort, you can look at what we call your large intestine 4, which is a very powerful acupuncture point, and you can see that you create a little hill with your fingers. And if you are pregnant, I'd advise that you not work on this point because it is an excitatory point. It's a yang point. You put your finger in and you massage down and inward to go right through the imaginary line through the crease on the inside of your hand, and you massage it, massage it, massage it until there is no more discomfort. If it doesn't hurt, then you can let go. If it hurts, then you continue on until the discomfort goes away, and often you can feel a cloud lift off if you do have a headache. And you do the same thing on the other side, and again you massage, massage, and massage until you can feel that there is no discomfort and that the tissues are very relaxed. If you are to do this routine of just checking in to make sure that nothing hurts, that there is no tension in these muscles, then you're doing a great service so that you can keep your teeth to 120 with very minimal fracture, wear, tear, and that you can wake up in the morning and have your very best smile as your best natural vitamin with lots of endorphin release. Here's to happy smiling. It's Dana Colson. Thank you.